Hello and welcome. Today we're diving into social pragmatic communication disorder, or SPCD. This condition affects how people understand and use communication in social situations, even if their general language skills are intact. We'll explore what causes it, how it works, what to look for, and how it's managed. The exact cause of SPCD is complex and not fully understood, but it's believed to be multifactorial. Genetic predisposition likely plays a role, meaning some individuals may inherit a higher risk. Environmental factors, such as early childhood experiences and interactions, may also contribute. It is also often observed in individuals with a family history of autism spectrum disorder, ADHD, or language impairments, suggesting a potential genetic link. Research is ongoing to pinpoint the specific genes or environmental triggers involved. Unlike some neurological disorders with clear structural abnormalities, SPCD's pathophysiology is more subtle. It's thought to involve differences in brain regions responsible for social cognition, language processing, and executive functions. Specifically, areas like the prefrontal cortex, which governs social behavior and decision-making, and regions involved in understanding nonverbal cues may function differently. This can lead to difficulty interpreting social signals and adapting communication styles to fit the context. More research using advanced neuroimaging techniques is needed to fully elucidate the underlying neural mechanisms. Determining the precise epidemiology of SPCD is challenging because it's a relatively newly recognized disorder, and diagnostic criteria have evolved over time. Prevalence estimates vary, but SPCD is believed to affect approximately 1% to 5% of the population. It's frequently diagnosed in childhood and adolescence, but can persist into adulthood. The disorder appears to affect males and females roughly equally. Further epidemiological studies are necessary to gain a more accurate understanding of its prevalence and distribution across different populations. The signs and symptoms of SPCD revolve around difficulties with social communication. Individuals with SPCD may struggle with understanding implied meanings, like humor or sarcasm. They might have trouble adapting their communication style to different listeners or situations, such as talking to a teacher versus talking to a friend. Taking turns in conversation can be challenging, and they may struggle to stay on topic or understand nonverbal cues like body language and facial expressions. These difficulties can impact their ability to form and maintain relationships, succeed in school, and function effectively in social settings. Diagnosing SPCD involves a comprehensive evaluation by a qualified professional, such as a speech-language pathologist, psychologist, or psychiatrist. The evaluation typically includes gathering information about the individual's communication history, observing their social interactions, and administering standardized tests of language and social communication skills. It's crucial to rule out other conditions that can present with similar symptoms, such as autism spectrum disorder, language impairment, or ADHD. Differential diagnosis is key to ensuring accurate identification and appropriate intervention. While SPCD isn't currently divided into distinct subtypes, the presentation of symptoms can vary significantly from person to person. Some individuals may primarily struggle with understanding nonverbal cues, while others may have more difficulty with adapting their communication style. The severity of symptoms can also range from mild to severe, influencing the level of support needed. Recognizing this variability is important for tailoring interventions to meet the unique needs of each individual. Treatment for SPCD typically involves a multidisciplinary approach. Speech-language therapy is often the cornerstone of intervention, focusing on improving social communication skills, such as understanding nonverbal cues, taking turns in conversation, and adapting communication styles. Social skills training can help individuals learn and practice appropriate social behaviors. Cognitive behavioral therapy at CBT may be used to address anxiety or other emotional challenges associated with the disorder. In some cases, medication may be considered to manage co-occurring conditions, such as ADHD or anxiety. A collaborative effort between therapists, educators, and families is essential for successful management. Currently, there are no known ways to directly prevent SPCD. However, creating supportive and enriching communication environments for children may promote healthy social development. Early intervention for children with communication delays or difficulties can also potentially mitigate the impact of SPCD. Promoting social-emotional learning in schools and communities can also contribute to fostering effective communication skills for all individuals. The prognosis for individuals with SPCD varies depending on the severity of their symptoms and the effectiveness of interventions. With appropriate support and treatment, many individuals with SPCD can learn to improve their social communication skills and lead fulfilling lives. However, some individuals may continue to experience challenges in social situations, particularly in complex or unfamiliar settings. Recent research focuses on identifying biomarkers for SPCD and developing more targeted interventions. Studies are also exploring the use of technology, such as virtual reality, to enhance social skills training. Future research holds promise for improving the diagnosis and treatment of SPCD, ultimately enhancing the quality of life for individuals affected by this disorder.